Have you been troubled with chronic back pain or spine related pain? Maybe you've seen multiple practitioners, clinicians, doctors, and haven't really got to the bottom of it. Well, in this video, I'm going to help you understand how to answer one really important question in spine care. Where is my pain actually coming from? I'm Anthony Ghosh. I'm a consultant spinal neurosurgeon and founder of the Spine MDT. When looking for a structural cause, I often ask, is it a disc, is it a joint, or is it a nerve? Because scans often show problems with all three of these structures, so it's really important to have a good clinical understanding of the general picture to figure out which one is causing it. To explain this, let's run through the anatomy of the spine. So the spine here is made up of a stack of bones called vertebrae that start deep in the pelvis and work their way all the way up to the skull. You have 7 bones in the cervical spine, 12 in the thoracic region, that's enclosed by your rib cage, 5 in the lumbar spine, and then you have a fused segment of bones deep in the pelvis of the sacrum and the coccyx, the tailbone. Each vertebrae, zoomed in here, consists of a cylindrical block of bone called the vertebral body here, with an arch of bone attached to the back of it. So if we make a cross section and look from the top down, this is the back, this is the front, this will be the vertebral body, and this actually shows the disc material. This is the arch of bone attached to the back with the joints either side, the facet joints, also shown here and here. And between each bone, each vertebral body, you have the discs, which are little cushions, shock absorbers if you like, between the bones. Through the canal that is formed by the arches at the back, you have the spinal cord, and in the lumbar spine just a bundle of nerves that run down in that canal. At each level there is a window either side, known as a foramen, through which a nerve leaves the spine, and in the lumbar spine each of these nerves will innervate a different muscle in your legs. It is quite common to see problems on MRI scans with the discs and the facet joints and the nerves all in one go in a single patient, but we do know from studies that these findings are common in a lot of people who do not have back pain, and that's why it's really good to understand how these structures behave clinically to figure out which one is the cause of your problem, if indeed either of them are. Let's start with the disc. If you have a tear in the disc, it is quite normal to feel an acute bout of pain, which is deep in the spine. It tends to be worse on leaning forwards or sitting for a prolonged period of time or carrying weight. If the material within the disc has started to herniate and pinch a nerve, then this can send referred pain down the leg and also be associated with numbness or tingling, or in worst case scenarios, weakness. Now let's look at the facet joint, these small joints at the back of the spine, here and here, that connect the arches together. Often the pain is deep in the spine, focused in the back itself, and usually slightly towards one side. It's often worse on extension, so trying to stand up straight from the bent position, or sometimes standing for a long period of time, and it can also worsen during twisting. This is caused by a type of arthritis or wear and tear in the joint. Muscles attached to this region can refer pain along them towards the buttock. Nerve related pain, often referred to as radiculopathy or sciatica. This can be caused by a slipped disc, as discussed earlier and demonstrated here, that causes compression of a nerve, sending pain, electric-like pain or sharp pain travelling down the back of the leg. It can be associated with numbness or weakness. This can also be caused by stenosis, a narrowing of the spinal canal here, compressing most of the nerves, which generates pain down one or both legs, which worsens when standing and walking. Final thing I want to discuss is the biopsychosocial model of pain when it becomes chronic. Often the pathology or the structural cause causing the pain becomes only a small part of the bigger picture. We start to develop avoidance techniques, different movements and loading of the spine can start to affect the pain, and then things like fear, anxiety, false beliefs about the cause of the pain, and then behaviours we adopt to try and manage the pain can make things worse. And that's what this bigger picture of pain is all about. So the goal isn't simply to just name the structure, but it's to understand all of the different mechanisms contributing to the pain, certain behaviours, avoidance techniques, and other things. And that's why I really believe in a team approach of not just me as a surgeon, but also me overseeing the care given by a physiotherapist, an osteopath, or even a pain specialist. I really hope you found this video helpful. If so, please click that like button and do subscribe to the channel. Also visit us at spinemdt.com to see how we can help you. Thank you for watching.